These are our children. In them are our joys, our hopes, our dreams. These are children of America, happy, healthy, and free. We dedicate ourselves to their freedom. We devote ourselves to their happiness. And in their health lies the fulfillment of our dreams. Yes, and we have learned much about their health in but a few generations. Man can cure, but better than that, he can prevent. He can protect against illness. There is a passport to health. Let us look in on one of our physicians and learn about this, what it does and why it is called by that name, a passport to health.
These cards are important, Miss King, and must be kept up to date.
Immunization records.
These are my office copies. Didn't Miss Vincent tell you about them?
She did mention them, but she didn't have time to go into detail.
We'll have to forgive her. A girl doesn't get married every day.
This looks like a very complete record.
It is. And it's a big help, especially with children. I have a complete record of their immunization history, and the parents keep a copy, too. That is, of the children who are immunized.
Most of them are?
Yes, but many parents come up with queer reasons or prejudices, or they're just careless.
I'll never understand that.
Sit down. Of course, they must have their children vaccinated against smallpox in this state before they can enter school. Not enough states have that law, though.
Something being done about it?
We're trying. It's an educational problem. Fortunately, there are people who realize the value of immunization. Take the Browns here. This is Dorothy's card. Mrs. Brown has been wonderfully cooperative. Dorothy had her smallpox vaccination at 4 months. By the time she was 9 months old, she'd been protected against diphtheria, whooping cough, and tetanus. Then at 18 months, we gave her scarlet fever inoculation.
She's all set, isn't she?
Dorothy's about 6 now, and some of these immunities may be a little low. They don't last forever, you know.
Yes, I see that she was re-inoculated against diphtheria last year.
That's another advantage of these record cards. They keep us up to date at a glance and remind the parents when it's time for checkup. In fact, Dorothy's coming in a little while. That's why I took out her card. That was her father who phoned a few minutes ago.
Shall I get things ready for a checkup?
Will you please? Oh, Mr. Brown said he wanted to talk to me. Entertain Dorothy for a little while, will you? You'll like her. She's a lovely, healthy child.
Hello.
Won't you come in?
Come on, Daddy.
Dr. Benson is waiting for you, Mr. Brown. Won't you step right into his office?
Thank you. You wait here, Dorothy.
That's a very nice doll you have.
You're new, aren't you?
Why, yes. I've come to help Dr. Benson. From now on. Come over here where we can be comfortable. How old is your doll, Dorothy?
Oh, almost a year. Where's Miss Vincent?
She left to get married.
Oh.
She was a very nice nurse, wasn't she?
Uh-huh.
Dorothy, Dr. Benson's told me a lot about you.
I like Dr. Benson. He's a nice man.
That's right.
You know what?
What?
I've got something.
What is it?
A surprise.
Surprise. For whom?
Guess.
Well, I'll try, but after all, I've only been here a short time.
Go ahead, guess.
All right, I'll try. Let's see. Is it for your daddy?
No.
Well, then, is it for Dr. Benson?
Oh, gee, you knew all the time.
No, I didn't. I just guessed.
Look. It's a picture of me with Daddy and Mommy and Tommy.
Ah, isn't that nice? Dr. Benson will love to have this.
This is me.
Mm-hmm.
See how little Tommy is? Tommy's just a baby, you see. Isn't he
After all, you were just that little once upon a time.
Oh, sure, but now I'm big and strong. I'm not a little baby anymore. I'm going to school soon.
Oh, you'll love school.
But Tommy won't go to school for a long time. Where's Daddy?
He's talking to Dr. Benson.
About what?
About you, I guess.
Oh, I suppose Daddy is thinking about me being all grown up again.
Dorothy's growing up fast. Imagine, she'll be in school soon. Fortunately, she's a healthy child.
Yes, Dorothy's health record has been fine. You and Mrs. Brown have done the right thing.
Well, Mrs. Brown has. I'm afraid I've been letting business push my family responsibilities too far out of the picture. That's why I wanted to talk with you.
Last time we really had a talk was the night Tommy was born.
And we talked him halfway through college. Well, now I want to come back to today and sort of catch up.
You have two healthy youngsters.
Thanks to you. Helen's kept me posted on everything you've been doing, but, well, to get down to cases, Dorothy's starting to school in a couple of weeks, and, well, I wanted to make sure that everything was taken care of.
Well, let's look at the record. You have her immunization record, haven't you?
Immunization record?
Never mind. Here's my duplicate card. Dorothy has been immunized against 5 dangerous childhood diseases. You know she hasn't had any of them.
That's true. But I've heard, well, from lots of sources, that all of this is open to question, that there are differences of opinion.
I hear those things, too. Is there anything special?
Well, one of the things they say is that it's better for the child to get some of the diseases and get them over with. It makes them stronger children.
How?
Well, the experience of having had the disease sort of, well, it makes the child more resistant to disease. It toughens them up.
Let's go over your argument. First, children's diseases are serious. The death rate is high, for one thing, and the after effects or complications are often more lasting than the disease itself.
Oh, I don't mean serious diseases. Take something like whooping cough.
They're all serious. And don't let anybody kid you. Take whooping cough. People think that children will get it anyway, so they don't do anything about it. But the death rate from whooping cough is 20 times that of diphtheria among infants.
I didn't think it was that bad.
And next year we can expect a couple of thousand normal, healthy youngsters, just like your son, Tommy, to die of whooping cough before they're even 1 year old. And, Mr. Brown, most of those deaths are unnecessary. But let's get back now to what you've been hearing. Letting a child get a disease to toughen him up is dangerous.
Oh, but I didn't think that.
Put it another way. Would any parents push their child off a porch roof so he could get over the experience of having a broken leg? Of course not. That's an extreme comparison, but the idea is about the same. Exposing a child to a disease whose outcome might not be what you expect is not exactly a good toughener.
Well, of course
People just don't know. Because of old wives' tales, take diphtheria. People just wouldn't question immunization for that disease if they had seen a child lying in bed, slowly choking to death, gasping for breath.
That's horrible.
Diseases don't toughen. They are tough. We do the toughening with immunization. Your body has the mechanisms for fighting disease, but it's a complicated process, and too often the germs get a fast start. The vaccines and toxoids and other immunizing agents we use are like catalysts or spark plugs.
Spark plugs?
Yes. Something that starts the body building its own weapons to fight and conquer disease before disease attacks. If you wait until the disease attacks, the body may not have time to build these weapons. Result? Perhaps bad teeth, bad eyes, bad heart, or a horrible pockmarked face that lasts the rest of the child's life.
You make it sound gruesome.
It's nothing but straight fact.
But isn't there some sort of immunity which a child gets from its mother?
Only temporarily. And it seldom lasts more than 6 months.
Yes, but if Dorothy has had all this, why go through with it again now?
These acquired immunities are not permanent. The duration varies, And so we check them at definite intervals and renew or reinforce them. That's another advantage of these record cards. It reminds the parents that this must be done.
But what if it doesn't work? You know, I've heard of cases where youngsters have been inoculated and then got the disease anyway.
Well, there have been cases like that. It happens occasionally with whooping cough. But with whooping cough, the effects of the disease are lessened and its duration greatly shortened. That makes treatment a lot easier.
Rather like insurance, isn't it?
Cheap insurance, too. How long ago were you vaccinated against smallpox?
Me? Well, when I started to school, I guess.
Most adults don't realize that they also need immunization against various diseases. The Army and Navy know this, and they protect their personnel, all adults too, by routine immunization. The services know that in the past, germs have caused more casualties than weapons. We don't take chances anymore with the men and women in our armed forces.
Well, maybe I ought to get some of that immunization insurance.
Anytime you say.
Well, not now. Let's stick to Dorothy. You know, she often says Dr. Benson gives me medicine to keep me from getting sick. She knows what she's talking about. You know, we parents should listen a little more carefully to our children.
May I have the pin? Ouch.
There. Now she's comfortable. Tell me, Dorothy, where did you ever learn how to change a baby?
Oh, I always knew. Ivan used to change Tommy when he was very little.
You did? All by yourself?
Well, Mummy used to help me.
You sure?
Well, but honest, I used to help Mummy feed Tommy and bathe him and dress him and everything. I like to do that so much that last Christmas I wanted a big doll to play with. So, on Christmas morning, I come down the stairs. What do you think? Oh, Mommy, she's beautiful. And I'm going to call her Susan, and I'm going to take care of my baby just like you take care of Tommy. What's that?
What's what?
What's the matter with Tommy? Did he hurt himself? How did it happen?
Oh, no, darling. Tommy didn't get hurt. That's just something to keep him from getting hurt.
But that's a sore, Mommy.
Well, I took Tommy to Dr. Benson, and he vaccinated him, just like he did you.
Me? I don't remember.
Well, that was quite a while ago. You were just about as old as Tommy.
Where?
On your arm.
Why?
Well, you know how Dr. Benson gives you medicine sometimes when you're sick? It makes you better, doesn't it?
And sometimes it tastes awful.
Yes, but it makes you well again. Then, there's another kind of medicine that Dr. Benson can put in your arm before you get sick. And that kind of medicine saves you from some very bad sicknesses.
But how can you get better before you get sick?
Well, you can. And if more parents realize that, there'd be less sick children. Let me see if I can explain it to you a little better.
Please, Mommy.
Well, with this before kind of medicine, the doctor shows your body how to fight disease, and it starts it practicing so that it learns to fight sickness without any outside help. Then when a big sickness comes along, your body says, I can lick you. I licked your brother, and now I'm ready for you. See?
Did Dr. Benson do that to me, too? Did I practice so I won't ever get sick?
Yes, darling. You won't get lots of the sicknesses little girls get.
Do doctors give all children before medicine?
No, many of them don't get it. Someday I hope all of them will. That would be wonderful. Be the most wonderful Christmas present the world could possibly get.
Mommy, I hope Santa brought Mary a doll, too. She told me she asked him. My doll is a little girl. Maybe Mary got a boy doll, and then the dolls could play with her sister. Let's go over to Mary's house. I'll take Susan along, and we can have her play with Mary's doll.
All right. And Tommy's all dressed. You hurry and get dressed, and we'll all walk over there together.
Here we are, Mommy.
Oh, Dorothy, wait. You can't go in. Mary's ill.
Why, Mommy? I want to show her my new doll.
Yes, I know, but you'll have to wait until she's well again.
How do you know she's sick.
You see that sign? Says nobody can go in.
Why can't we go in? Is she so sick?
Yes, dear, she's very bad. Now come along.
Why'd she have to get sick? Didn't she have any before medicine?
No, I guess she didn't, dear.
Why didn't she?
Well, I can't answer that. Perhaps because Mary's parents just moved in. They hadn't gotten around to it yet. Or maybe Mary's mummy was afraid. She felt this couldn't happen to her. Almost any reason under the sun. I'm thankful I'll never have to ask myself why I didn't do it.
What, Mommy?
Never mind. The doctor will cure Mary, and then you can play with her again. Come along.
And I never did get to show her my doll, Susan.
Oh, you never told me this was Susan. My, but she's beautiful.
Of course I told you. Susan is my best doll. And she has blue eyes and dimples.
And a diaper just like Tommy's.
And I love Susan. And I'm going to take good care of her.
Hello, Dorothy.
Dr. Benson. And I never did get to show her my doll, Susan.
Oh, you never told me this was Susan. My, but she's beautiful.
Of course I told you. Susan is my best doll. And she has blue eyes and dimples.
And a diaper just like Tommy's.
And I love Susan. And I'm going to take good care of her.
Hello, Dorothy.
Dr. Benson. Wait a minute.
Let it out. Take another. Well, Dorothy, you're fine. We'll just give you a little more diphtheria toxoid, then later another vaccination against smallpox, then you'll be all ready for school. You'll like school, won't you?
I can read and I can write my name. Mommy showed me how.
You have a very good mother and father. That's why you're so smart and so well. Will you bring me the toxoid, please? This won't take but a second. And then you can dress and we're through for today.
Dr. Benson told me how much this helps you.
Well, here we go. There, that's finished, Dorothy.
That's the second time today, isn't it, Dorothy? She pricked herself while she was changing a dolly's diaper.
That's finished, Dorothy. You'll have to come in to see me again before you start school. Then you'll be as fit as a fiddle. You may get dressed now.
I didn't realize how little I knew about this immunization business. And, as usual, Mrs. Brown knew it all the time.
That's knowledge that comes with motherhood. Knowing how to protect her child from danger. And let me tell you, sickness is danger.
Dr. Benson, I want to talk to you. It's very important.
Yes, Dorothy?
You fixed it so I won't get bad sicknesses, and Tommy too. But you never did Susan. She's getting old now, and I'm worried about my baby.
There's a mother again. Yes, Dorothy, I guess we have been rather neglecting your baby. But it's not too late. She's well now, and she's not too old for immunization. In fact, no one is ever too old for that. Will you prepare the patient, please, Miss Gaines?
Now, Susan, you be very still, and I and the doctor will take good care of you. Won't we, Doctor?
We certainly will, Sue. We'll just give you a little diphtheria toxoid. Will you bring the toxoid, please?
This will only take a second, baby. I know.
There, that's done. That didn't take long. Of course, you'll need more. You're a very good mother. You know, Dorothy, if all children had immunization records as complete as yours, the school authorities wouldn't worry nearly as much as they do.
Nor would millions of parents.
You can include the medical profession, too. Well, that's that. Now you've had your granddaughter inoculated. You're a grandfather. How does it feel?
Well, I don't know. I'll have to get used to that, I guess.
I'm happy, and you're the best friend I ever had. 'Cause now Susan won't get bad sickness. Will you, Susan, baby?
Yes, Dorothy and Susan are protected. They have their passport to health. And all the Dorothys and Susans and Tommies, all our children can get this passport to health. Immunization, the key to healthy childhood, has already brought about a marked reduction in the incidence of children's diseases. In the year 1938, 30,508 diphtheria cases were registered by the United States Public Health Service. During the 5 following years, through immunization, we have reduced this number to 13,744 cases. Progress? Yes, but not enough when you consider that diphtheria could be controlled entirely if all children were properly immunized. Smallpox in the year 1938 attacked 14,939 children. Immunization brought this number down, and down until 5 years later, only 742 cases were registered. Yes, we have made progress. We are on the right road. Let's continue. These children are our children. We have it in our power to protect them. We want them, all of them, to have the opportunity to grow up happy and healthy. Give them a passport to health.